facilitate mental health and resilience. Now, the learning objectives are quite broad. We're going to start off by talking about natural disasters and the impact on climate change. We're going to talk about the various vulnerable groups and those who bear an increased burden, including climate refugees, and all of this from a Caribbean perspective. We're going to talk about what we're going to try to continue to do to mitigate against the population mental health consequences of climate change. So we have some general learning objectives, and we're going to be focusing, because it's so broad, on certain specific issues, especially those that are particularly relevant to the Caribbean. Now, I begin the presentation with this slide because I think it's really important that we keep in mind that the changes we're trying to facilitate are not changes on a blank slate.
Dr.
People
Weller,
have their...
sorry,
yes?
Sorry to interrupt. You actually haven't started sharing as yet. You haven't shared your slide?
Oh, it's not shared yet?
No.
1 second. Okay.
Yes.
So now we're getting the slide that I'm actually on now.
Yes. Perfect.
Great. So, paradigms, perspectives, and practice. What exactly are we trying to do? We're trying to change people's mindsets. We want to change their mindsets about climate change, and specifically in terms of coping with the negative impact of climate change. The slide on the left is really a reminder. Many of you may have seen it already. A reminder of the fact that people see things differently depending on their experience. So some seeing this image may be seeing an old woman facing to my left, or others may be seeing a young woman looking kind of towards the back. Now, psychologically, what we see may be determined by many preconceived dynamics and conditions. The point here, though, is that people see the same thing, but interpret it differently. And it is critical that we understand that as we try to promote awareness and an understanding of climate change and the mental health implications, we have to understand where people are coming from. We have to understand their mindsets and then try to engage them where they are. However, one of the challenges we face right now is that people are overwhelmed. And the image on the right is a reminder that you are seeing multiple things at the same time. You're seeing a man facing you with an earring and a man looking to the side. And they're both existing. And unlike the first image on the left, the one on the right keeps shifting and alternating. You see one, then you see the other, then you see one, then you see the other. And this is very much, to me, indicative or representative of how people feel now. There's so much going on, and it doesn't all fit together, and they're not quite sure what to make of it. And this, of course, is part of the reason why we have trauma that is unresolved and distress that actually is sustained in a chronic way. Our role, therefore, is to be able to understand the paradigms and perspectives and influence the practice of all who are involved. And you'll notice that I am not focusing only on mental disorders, etc. I'm talking about human behavior. I'm talking about the impact of climate change on all of us, the role that we must play as healthcare providers and all our colleagues. We have to change too, as well as our public, our citizens, our clients, our patients. And it's a complex situation, and one, therefore, that we need to at least appreciate the complexity and be able to take action in the various spheres in which we operate. Because here's the rub. On the left, the person sees it as a 6. On the right, the person sees it as a 9. Psychologically, they're processing the data that they are receiving from the perspective that they have. So again, it reminds us that in our work, we need to understand the diversity that we're operating in and the diverse views, and diversity also in terms of ethnicity, religion, life experience, etc., etc. How do we get folks to understand that actually the science will tell you what is there? It's not about attitudes only. It's not about this is my belief, so I'm going to see it this way. We are promoters of science, and the important central role that science plays in appreciating climate change, appreciating human behavior, and appreciating how those two need to be integrated for mental health. So As we go forward, therefore, it's really sad and unfortunate that mental health continues to be excluded from most conversations. And that is why this forum is so important. And I'm glad that this topic was included, because there's so much inattention, even though the mental health effects far outnumber the physical effects when represented in a lot of the research. So climate change, weather-related disasters have increased dramatically in this case, and that was in 2018, it was 46%. The truth is that even with these increases, the last Lancet countdown and the last two COP conferences, 25 and 26, still did not prioritize mental health, and did not address enough the behavior change component of the psychology of climate change. And it is not that every healthcare worker is going to become a psychologist, but this is a perspective and it's a paradigm that we need to have if we're going to facilitate the kinds of change that we want to achieve. Because we keep talking about mental health and resilience and wellness. It's important to keep in mind that a state of mind characterized, and I'm just going to say emotional well-being, behavioral adjustment, freedom from anxiety, disability, not being disabled by symptoms, and the capacity to establish constructive relationships and cope with the ordinary demands of stress and life. That is mental health. That is at the core. And from that, we must build a resilience, which becomes a protective factor for the psychological distress. It's a mental fortitude. But one of the points that I want to emphasize here is that at the core of things, at the heart of things, must be a state of mind that manages continuous resetting, coping with all the trauma, all the challenges that we face. And these core skills are something that we all need to have, we all need to advocate, and we all need to facilitate. So good mental health skills in day-to-day life lead to resilience when there are times of trauma. You don't start doing an intervention when the disaster is hitting. So climate change impacts health. And those of us who are familiar with the Bible saying says, as a man thinketh, so shall he be. Of course, I've added as a woman and she. The reality is that if we don't influence the mind, we're not going to influence the behavior. The thinking has to be influenced. And so climate change impacts health. But on the right, you see at the very center is the brain. The mind, the mental health, it affects the medical and physical, it affects the community, it affects people of all diversities, and it influences how they respond to these climate change disastrous effects, but also how they can be a part of prevention, a part of mitigation. The mind is at the center of all of this, and it must be connected and it must be integrated. And we are the ones who have to understand this if we're going to facilitate this change. So, we talk a bit about climate change. Sorry, I jumped ahead there. What it is, persistent change over an average, above average, over time, affected by a variety of factors, including human behavior. Everything from greenhouse gases, et cetera, use of electricity, transport, it all involves people's behavior. And so we have got to keep that at center. What we do, how we do it, when we do it, why we do it, these are all critical if we're going to manage climate change. Whether we're talking about the economy, and the Caribbean is significantly affected, the economy is not just about, forecasting trends and who has bought what company. It's about the people involved and how they're affected. Economic losses mean economic losses to people. So we have to understand and have the people perspective. We have to have it when we're talking about the vulnerable groups, and keeping in mind that, if you're talking about air pollution, the numbers about air pollution are only part of the story. The impact on people, whether it is people with asthma, who are then stressed and anxious, and that anxiety feeds into other dynamics. The caregivers of the asthmatic are now stressed and have to find resources to buy the inhalers, et cetera. The people factor, we have to promote it. When we talk about the various communities, and while this slide might be reflective of perhaps a North American perspective, talking about communities of color, etc. We have very diverse communities, which sometimes we don't address. We don't factor in our understanding that within the Caribbean, yes, you have Afro-Caribbean, Indo-Caribbean, Hispanic, we have people with various religious beliefs, faith, parts of various faith systems. We have social class diversity. We have urban-rural diversity. We have gender diversity, age and stage. All of these have got to be factored in if we're trying to understand people, if we're trying to understand how they behave, why they behave, and how we can influence their behavior. Again, whether the behavior is trying to prevent them cutting down trees and deforestation, or the behavior is trying to ensure that they don't get stressed, aggressive, and engage in gender-based violence. We need research, we need data, and we need theory and data-driven interventions. Whether you're doing counseling and therapy or you're designing a behavior change program for health promotion in mass media. So, poll question 1. Haley, are you handling that?
Yes, yeah, the poll is launched right now. We'll give participants about a minute, and I'll share the results with you.
Great.
Can you see the results, Dr. Weller?
Yes, I can see the results, and I'm going to integrate my discussion of them into the next slides that I'm showing. So we have the majority attributing to nature, second to God, and after that, the minority to man-made. So, if you're going to make a link between climate change and mental health and human behavior, we have to move beyond this focus on the discrete disasters, because it inhibits our, our adaptation planning for the long term. And this is why education about climate change and mental health is so important, and a forum like this is critical. We're going to get better management of stress, yes. We want to promote resilience. We want to get healthy adaptation, but we also want to increase engagement in climate change. And the more we understand about how people see these things and where their focus is, the better we can engage in that process. We know that disasters and climate change, weather events can be looked at, in terms of acute events, floods and hurricanes, subacute, those that go on longer, pervasive droughts and heat waves, and the chronic ones that affect us. In the Caribbean, we might be more aware perhaps of increasing temperatures, etc., and rising sea levels, which we're going to talk about later. But truly, melting polar ice caps are the cause of most of the cause of rising sea levels. So we should be concerned, we should understand that all of these lead to direct, indirect, and overarching psychosocial consequences. And if we're going to be developing mental health and psychosocial interventions, whether they're integrated into regular public health, healthcare, clinical care, or in targeted psychological spaces, we need to understand how these dynamics affect people differently. So the direct, well, you have the floods and the hurricanes, and we have those. We have the heat waves as well, and in some countries, there are wildfires that are far more damaging than in others. We have the indirect, and we've touched already on the social and economic upheaval that we're experiencing. The conflict, the internal displacement, the migration are all Caribbean experiences that are related to changing climate and climate dynamics. All of them, of course, contributing to the ongoing stress that people are experiencing, but adding a particular dimension that really exacerbates, along with COVID, our lack of sense of control and our concerns about our future well-being. So there's this kind of pervasive, overarching dynamic of stress that is then made worse by the direct and indirect, experiences that people have. Yeah, we can break this down in many different ways. I'm just sharing this image, of flooding and of talking about the grief and anxiety and the outrage and violence and the blame that result. Very often we focus on the anxiety and depression, but don't understand that the stress is also affecting people in terms of their cognitive functioning, their ability to concentrate, to focus, to be productive. And it's affecting relationships in terms of interpersonal aggressive acts, violence against women, family violence, and blame, for example, with the government seeing the authorities as not caring and not doing enough, because of course, those who are financially stretched are most dependent on the state, and flooding affects the greatest number of people. So it's really a complex of different feelings and emotions and thought processes that result from the impact of climate change and extreme weather events. And because the Caribbean is second most disaster prone region in that context in hurricanes. I mean, most of us who are from the Caribbean and who attend to media will be familiar with all the hurricanes that have come through in the last few years, the increased number, the fact that in some countries there have been dramatic numbers of fatalities and displacement because of loss of housing, infrastructure, and of course, employment implications. I don't think we need to spend a lot of time talking about those, but just to say that, again, when we think about these climate change events, effects, etc., we think about people, we think about mental health, but we think about mental health, both in terms of self-care and managing emotional dysregulation, and mental health in terms of resilience and efficacy and engaging in action to try to mitigate. Droughts, again, another chronic experience. It's life-altering. It causes a lot of distress, and in some places is known to be linked to suicide, but certainly we know about malnutrition, starvation, and unfortunately, you then begin to get more conflict between groups as groups fight over arable land, water access, etc. And then you have, displacement and the migrants as people seek asylum away from both the conflict, but also the lack of resources and access to resources. You have heat, and in previous presentations, the lecturers have spoken about a number of these things. I'm just pulling out some points to highlight that heat is shown to be related to suicide, depression, dementia. It affects people who are on medications and who are not able to directly manage hypothermia because of the medication. So many different ways in which these particular climate effects mediate the climate change and the mental health and well-being of people. A lot of distress, a lot of anxiety, and not necessarily named or understood, and therefore not coped with well. Air pollution, I mentioned already the neuroinflammation, the asthmas, etc. The longer term effects that are being shown in terms of increased risk of mental illness, future anxiety, risk behavior, etc., among children and adolescents. When in the Caribbean, we are particularly challenged, and it's something that we have to wrap our minds around, because sea level rise is going to have potentially a dramatic effect on island states and states with all the countries that have coastlines, Guyana, etc. People living on the coastlines are going to have serious challenges to their livelihoods and well-being. And the more they hear about this in the media, even if it is not affecting them yet, the more it is a stressor to them. And with some acute climate events, at least I should say, whereas with some acute climate events, victims can do something about it by taking action, by seeking help, by moving and returning when things have changed. With sea level rise, they can't do anything to stop it. And although governments can work to adopt measures to mitigate, in the short term, they're going to rise. And in the short term, as long as more people become aware of this, the anxiety, the helplessness, the loss of control and self-efficacy is likely to increase, all contributing not only to emotional dysregulation, but also to a sense of not being able to be in control, and that hopeless and helpless feeling. So just for effect, I'm just going to show some images that highlight some of the disastrous climate change effects in the Bahamas, hurricane, flooding in Guyana, deforestation in Haiti, and the volcanic ash in St. Vincent. As you look at these images, and I'm not going to talk a lot, it's for you to think about the people dynamic in there. Yes, there's infrastructure, there are a lot of dimensions to it, but how do people feel when they're living through this? Or when they see it as a potential of something that is likely to happen more often? When they look at this yacht that has been submerged, but we see the house behind, and we think of the people who are living there. We think of the people who worked on the yacht who have lost their livelihood. We think about the people who may be in the tourism sector, which this may have been a part of, who no longer have secure employment, cannot afford their previous lifestyles, etc. Challenges in terms of sitting among the wreckage and realizing that when you rebuild, the same event may happen again. And it may happen in such a way that they lose what they had already lost twice. So re-traumatized. And I think that that is also a critical issue to be considered as we move forward. The flooding doesn't have to be hurricane related, but also something that happens regularly in the Caribbean. We have the deforestation in Haiti as another example of the impact of human behavior on climate change, and then the impact further back on humans because of these changes in the environment. We know in Haiti that has led to severe challenges in terms of the economy, in terms of driving displacement and migration. And of course, as a reminder, when we look at the slide of the ash covering a whole community, we are reminded that the volcanic eruption in St. Vincent didn't only affect St. Vincent. You know, the ash was all over Barbados and other places. The disruption to the food supply of fruit and vegetables that come from the region, the impact on individuals in terms of their livelihood, the loss, the grief, all of which are dimensions that must be considered and must be addressed as we design programs and as we provide services. There's really not a lot of data about climate change. I pulled out a couple, you know, there's evidence of distress and sleep disorders, of chronic distress, and a lot of emotional dysregulation around loss, around unemployment, homelessness, etc. And unfortunately, a growing sense that the future is negative, as reflected in this comment from the Bahamas. But what I think is really important is that we need the data. In the work that we've been involved in at Cantor, and I have been involved in other contexts, when we visit countries, islands who have been affected by disasters, it's very rare that you get data about the mental health. You may get that they're not sleeping well or they're anxious, but anxious about what? Coping in what way? Which ways are healthy? Which ways are unhealthy? Which coping differs by gender? Or how does coping differ by age and state? We need more research because our interventions, as I keep saying, have to be both evidence and theory driven. And our interventions, as I keep saying, are not just only about coping with the trauma, it's also about engaging in mitigation. So we have to be mindful when we're framing these natural disasters to the public and to individuals because the impact may vary. Cultural beliefs, and there are very diverse cultural and faith-based beliefs in the Caribbean, mean that that question I asked before has implications for how we can engage with people. If they believe that acts of God are at root of this behavior, then they'll have one set of reactions. If they believe it's just part of nature, a different paradigm, and man-made, a different paradigm. So what we're talking about here is doing the kind of data that helps us to understand what people think about why something happened, who or what is responsible, could it be prevented, and understand the process wherein you're going to have to work through these different stages of reaction in order to reconcile. But, and here is the rub, If people feel that it is an act of God, then perhaps they may feel that their prayer, etc., will take care of them. There's nothing they could have done about it. When they feel it is nature, there may be a greater sense of a lack of efficacy and control. And our interventions with them must appreciate where their mindsets are. When a disaster is experienced as a result of human behavior, research is showing that it is more challenging to recover. So we need to be forewarned and forearmed, but we have to have our own data. We have to do our own research in the Caribbean region to understand and to realize that one size will not fit all. So while we try to share messages that increase awareness, we also need to understand that individuals will need different messages if they're going to carry on, because the degree and impact of the disaster on the mental health will be affected by these various factors here: the intensity, the pace, the suddenness, etc. Part of what we have to try to do is to help normalize this. Again, when people feel that how they're feeling is something bizarre and strange, they don't feel in control. If they are taught that this is a normal reaction to an abnormal situation and there are things that you can do to cope, they are far more likely to be resilient and respond and cope better. I wanted to highlight this because I mentioned before that cyclical nature of certain extreme weather events is important. And in the Caribbean, we have the hurricane season, which is about to start again in June, and which we have now got to prepare for. And unfortunately, we're doing a lot of work in the region that does not integrate an understanding that people already have had trauma. They've heightened anxiety levels, a sense of doom, fatalism. Their distress is amplified. And now here we have a new season coming again. They haven't repaired the house. They're still having nightmares from the last hurricane season. A thunderstorm traumatizes them, children can't sleep. And now they're about to enter a new season of vulnerability. So the seasonal nature is something that we have to appreciate. And again, this is where public education and health promotion is so critical. If we're going to alleviate the trauma. And also if we're going to help to engage folks to attend to what is going on so that they can be part of the mitigation. If they're in denial because they're so busy trying to cope with the psychological stress of what they're perceiving, then they're going to lock down everything and you can't get them to engage in picking up the garbage or not engaging in activities that are going to affect the climate. So there are many burdens and anxieties, and we have to help people understand that it's normal. We can't prevent it necessarily. It's going to be part of a Caribbean reality, and a healing process is helped when we can look at these things, understand what's going on, and make authentic, realistic, legitimate actions to prevent further trauma. We have to create a sense of understanding and normalization and promote a sense of control and hope. I think hope is critical. So when we pull together all of these things, we realize that we have the geophysical changes associated with climate change. They affect the acute, the chronic, those affect the economic and social, and then affect the individuals and the communities, whether it's PTSD and depression and anxiety or behaviors that are negative in terms of suicide and aggression, etc. We have to be part of the solution, but we need to understand the process and then help people to understand it so that we can then engage with them. A whole mix of feelings are being triggered, and as we go along, we have to find a way of organizing it. Now, Albrecht has come up with some terms that try to pull together these three different levels of impact. The one that we're probably most familiar with is eco-anxiety, which is the anxiety people feel from constantly being surrounded by threatening problems associated with changing climate. And it's interesting, as I said, that eco-anxiety, as real as it is, may not be understood. People just feel at risk. They just feel vulnerable. And we have to help them name it to tame it. But we have to know what names to use. So eco-paralysis is a name given to that sense of not having any effect, the complex feelings of not being able to be effective to make changes. We have to give people a sense of hope and a sense that they can make a difference where they are and that collectively they can make an even greater difference. However, it's very challenging. It's very challenging because things are changing so much. And so solastalgia is the term that is given to that whole dynamic of the distress and isolation caused by loss of the familiar. And you don't have to migrate or be a refugee to have lost the familiar. If you're looking up at the mountains and they're no longer green, if the water is not available and your garden that was your pride and joy is no longer sustainable, these are all changes in the familiar. If your relatives or your best friends have now migrated for a better opportunity and you no longer have the people around you, solastalgia is part of the dynamic that you're going to be experiencing. So while this language is not necessarily language that would be really accessible to everyone, it does provide a conceptual frame for different levels of intervention that we need to have when we're thinking about climate change and mental health. Because keep in mind that, as COVID has taught us, pre-existing conditions are critical. They increase our vulnerability and risk. They can increase our resilience as well. But we have a whole range of existing and pre-existing anxiety disorders that are likely to be triggered because of the continued messaging about how difficult things are going to be. So you have people who are vulnerable because of pre-existing psychological and including anxiety disorders, but we have other psychiatric disorders. We already mentioned the dynamic of those with schizophrenia who might be on medication. We have the dynamics of those individuals who have personality disorders, who have very rigid ways of coping. And as things external change, they become even more rigid. So you're going to have people who are becoming more narcissistic, people are becoming more dependent. All of these are dimensions that need to be understood because our interventions, as I said before, cannot be a one-size-fits-all, but we need to be able to target and understand patterns that may allow us an entree to having effective intervention. A lot can be said about the different vulnerable populations. The elderly, I've mentioned before. And one of the things that I think is not really understood is how disorienting all of this is for folks whose cognitive functioning is not as it was before. You may have the extremes of the dementia, etc., and of course the physical illnesses that are exacerbated by the stress. But at a very basic level, many older people just can't comprehend, they can't understand, they can't connect the dots, and therefore feel even more vulnerable and at risk. The children and young people touched on before the effects of their emotions, on their self-esteem, on their worldview. You have adolescents who now are feeling very much as if there's not much hope for the future, there's nothing that they can do. And therefore, of course, that kind of stress and that kind of worldview is going to lead to increased types of behavior. Perhaps among the young men, you're going to see more risky behavior. Across the board, you might see more use of substances. It's one of the reasons why we're probably seeing so much addiction to gaming, for example. It's an escape that takes you away from what is going on. It also gives you a sense of efficacy because you're playing a game and you're winning and you're getting points. We've touched already on the poor and those whose jobs are tied to things like tourism and farming and fishing. People are sick, those with impairments and disabilities. Women in general, because very often they are the breadwinners, they're the ones who are in society tasked with being the nurturers and the caregivers. So when people need care, it's a burden. But of course, pregnant and postpartum women have their unique concerns as well. Mentioned before, those who live in areas that are affected, and of course, the mentally ill, who already are not functioning at the best level in terms of understanding what is going on, of making healthy choices, and therefore are triggered far more perhaps than others when it comes to mental health issues. So, just to touch again on the children and the emotions that they experience, the childhood traumas, the lifelong predisposition, the epigenetic issues, and of course the risky behavior and substance abuse that I touched on before. Of course, all of that emotional dysregulation is experienced by those who are displaced, the migrants and the climate refugees. They have particular challenges as well, because along with the financial, social, and personal stress, and the solastalgia of being in a strange place, they have to deal with all the anti-refugee sentiment and get blamed for all the psychosocial ills. There are lots of examples that can be given. We have a lot of regional migration, Venezuelans into Trinidad and other areas. We have the Haitians and others who have moved because of their dire circumstances. A lot have gone to the Bahamas. And then we've had, the displacement within countries. I mean, even between Antigua and Barbuda, when Barbuda was so badly damaged, a lot of Barbudans had to go to Antigua. And what happens, therefore, is what were previously subtle differences begin to get exacerbated. It leads to a lot of interpersonal challenges. We all look for somebody else to blame when things are going wrong. And so we choose the outsider, which is really a prime way of focusing on blaming refugees and migrants. Whereas at the same time, these folks are searching for safety and security. And instead of achieving that, it's often followed by aggression and violence. And in the back of their minds, they never know if they'll ever be able to return. Yes, in Antigua, the Barbudans were able to return eventually, but not after quite a lot of angst that developed within and among the different populations. In the Bahamas, just giving some examples, when the hurricane hit, there were a lot of mixed feelings about who should get benefits. And I did some work recently, and a lot of providers were saying that on the ground, people felt that not enough was done for Bahamians and too much was done for the refugees from Haiti, etc. So there are multiple dynamics which we have to be aware of, which we need to factor in and use to allocate resources, but also to do that whole public education to create the paradigms and mindsets that will mitigate against these problems. I just wanted to take a minute to highlight some groups that are vulnerable that we need to be aware of, because again, in the work that CANPA has done across the region in responding to disasters, we often forget some groups. Now, first responders have gotten attention, again, because of the COVID pandemic. Healthcare workers and first responders are now prioritized. However, who we forget are the ones in the back room, the ones who are running the programs, who are organizing, the technocrats, etc., who themselves are being affected by the disaster, but have to manage people who are being affected by disaster and allocate resources that are limited, etc. And very often are quite traumatized. And when the head of the stream isn't functioning properly, what happens downstream is not a good thing. We have to think about climate experts who live their lives immersed in trying to stem the tide, and which can sometimes feel like a continuous process of decline. The activists in similar situations. And of course, we talked about the poor and rural populations. But many of us are vicariously traumatized. And I think that is something that we're becoming more aware of, that background noise, that continuous thing of, well, why bother? Because it's just going to get worse. You're just seeing all of the negativity coming, and we don't know how to cope with it. Again, very often because we haven't named it, so we can't tame it. Aggression and violence is critical. And I wanted to spend a little time talking about, well, first of all, the data shows that it increases as a result of climate change. But what we have to be particularly concerned about is the overdetermined or multi-determined aggressive behavior that we're seeing. And among the worst, of course, is the gender-based violence and violence against women. Now, violence in general is an increasing problem. Most of the violence is men perpetrated against men. So we have to be aware of that and concerned. However, what we're also seeing is an increase in gender-based violence within the family and violence against women in particular. And we've had horrific cases recently in Trinidad and elsewhere of women being murdered by partners. Climate change, therefore, is also about systems of power and control. And when we talk about attribution, when we talk about faith-based beliefs, etc., that's one area that has to be considered in terms of nature versus the hierarchical pyramid of power. But then that plays out also in interpersonal relationships. And so you have many men who feel as if they're losing their control, yes, but also their role and their sense of our future, etc., and feel challenged by women, or if not challenged by women, they just feel stressed and use their aggression against whoever they feel is weakest. This is a complex area and one in which we really have got to all understand the intersectionalities, because if nowhere else intersectionalities of our sociological programming, or including our faith beliefs, etc., or culture, and then the lived realities of the challenges of the multiple stressors, and then in this broader context of climate change, which keeps reinforcing, unfortunately, a negative sense of hopelessness and helplessness. The data about violence and aggression increasing is really transcultural and transregional. We have to get a handle on how we need to prepare to manage what can be predicted to happen and what we can do to mitigate against it. Family violence is going to include violence against elders, elder abuse, it's going to include child abuse. And when you have belief systems, and I'm going to give you an example, if you believe that to spare the rod is to spoil the child, if that's part of your belief system, and it is informed by your faith belief, then at a time when the world seems to be going crazy, it's not surprising that those who have those beliefs may increase that behavior because they want to make sure that things are under control and children behave themselves. Once we begin to understand the complexity of those behaviors and we can break it apart, then our interventions can be more effective. And healthcare workers very often are at the forefront of observing the effects of violence on individuals and on families because of the physical nature, and therefore are in a position to begin to facilitate interventions to mitigate and to support individuals who are victims. But it is important to remember that most of the aggression and violence is going to be emotional and verbal, and those scars are hidden. And we also have to therefore factor into our health promotion, our mental health and climate change interventions that address those aspects. And we're going to be talking a bit about some of those interventions that we need to target after this, but let's look at poll question number 2. Thinking for yourself, if you're going to be a climate activist, if after all of these sessions you've attended, you want to be more involved, what do you think is the area that you need more training in? Is it about the science of climate change? Is it about communication skills and how to be a persuasive advocate? Or is it about understanding policy development and knowing where you should focus if you're going to get change made at the macro level? So let's see your votes on these. Interesting. So policy development is trending in the majority. We have facts about climate change and communication skills just about holding even across the participants. So let's move along and we'll integrate the discussion of that with the issues that are coming up in the last set of slides. For some reason. Yeah, so what does all of this tell us about mitigation and adaptation? Well, of course, mitigation is about reducing vulnerability by reducing the behaviors that promote the negative climate changes. Whereas adaptation is really about reducing the likelihood of those things affecting people by limiting the impacts. So again, as we keep talking about this whole concept of mental health and the role of the mind and behavior change, we need to keep in mind that we want to change the way people behave so that it can have less, they can be less often be drivers of the negative climate change impacts, but we also have to help them manage the impact, be more adaptable in a healthy way. So just to highlight some points, we have to be careful about pathologizing common distress responses. As I said before, there are normal responses to abnormal situations. We don't want to make people feel that something is wrong with them because they're scared or anxious or feeling helpless. We actually need to let them know that that's normal, but it's manageable. And at the same time, we need to understand that people have pre-existing conditions that may be exacerbated. So we don't want to underdiagnose the real mental health effects that might require a different type of intervention. And one of the challenges with engaging people, of course, is that it's so intersectional and multidimensional that it's hard to identify in people, for people, causal links, that if I do these things, it's going to lead to this effect on me. There's too much going on. And so attributions related to climate change have to be understood in the context of these complex behaviors. Too few studies are available for the Caribbean, and in general, there are too few studies that look at something that is going to be very important, which is what are the positive psychological dimensions, the consequences. You know, we have seen, and COVID again is a case study in increasing levels of altruism, collective support, compassion, altruism, etc. We need to understand how those can be facilitated even as people are feeling the negative effects of climate change. So we need more data in general, but we need more to help to highlight the positives so that we can build on them and facilitate the resilience. So we're trying to deal with the overarching effects. We're trying to act on the health consequences. They operate at both the global and local level. So whatever we do, it has to be a balance between helping people to change their use of fuels, their attitude towards use of air conditioning, for example, their nutrition. But then it also is about helping them to cope with all of those emotional dysregulation and stressors that they're experiencing. So that adaptation is about all the interventions, adjusting, moderating, and coping. But it is affected by the capacity to adapt, which is the ability and willingness to respond. And those are determined by many systems of which we are a part, you know, the governance, the economics, the institutions, etc. So whether it's education, whether it's capacity building, whether it's preparing to manage the extreme weather events, there are multiple entry points for adaptation that will help to address the psychological dimensions and the mental health dimensions. Because psychological adaptation requires that you acknowledge the threat. But if we overwhelm people with information, then they're likely to go into avoidance or denial and not cope in the way. And if they don't understand their feelings, and if they don't understand that some of them are normal, they don't learn to cope. And then it becomes a creeping problem that is unacknowledged and made worse by day-to-day experiences. So we need to promote behavioral and psychological engagement, allow people to change and adjust their behavior and manage their life to reduce this perceived threat. We have to promote that efficacy. But we have so much stigma in the Caribbean around mental health and around help seeking, etc., that it is hard to sometimes engage people. They feel they're going to denial, they're going to avoidance, and that denial and avoidance seeps into other aspects of their life, and so they become less proactive. So what do we need to do? And I'm just going to go through these quite quickly. We need to look at how we need to help individuals. So it's about building their beliefs in their own resilience. This is about creating hope, fostering optimism. When we're working with patients or communities, in whatever context we're working in, we want to cultivate the active coping and active hope. We want to maintain practices that are there already. So we want to remind people that they have hoped before. They're not inept, they're not naive, and we need to reinforce that and promote the connectedness among individuals. At the community level, we really have to build those infrastructures that are going to facilitate community mental health. It means dealing with the disparities and paying attention to the populations that are of particular concern. It means building capacity among community members who can be informal, they can be volunteers, whoever, but we want to start moving people up a learning curve and helping them to move others. We have to look at the distribution of resources, and we've seen already, and I mentioned in the Bahamas, how that can become an issue that creates in-groups and out-groups and becomes politicized. And we have to communicate, we have to give information, because nowadays people have so many sources that we want to have communities that have a sense of, you know, and community leaders who have a sense of validity and authenticity in terms of the messages that they're sharing about climate change and its impact on individuals and communities' well-being. We also have to be very practical in terms of how we help people to have emergency plans, how we help to create the mindsets to prepare for adapting. Caring for yourself and caring for others, it has to become something that is, you know, we do it already and we do it in other contexts, but we need to understand how much more important that is in life now. And of course, mental health and other health professionals are in a unique position. We are in a position where, because of our field, we have a certain validity. We can become advocates, but we have to be literate. We have to understand these dynamics and their complexity. We need to know where the answers are and be able to promote science, ensure that others are doing the same thing, and most importantly, translate. We need to be able to translate concepts like solastalgia, etc., into language that people can access and integrate and make use of at the personal level. So, for question number 3, what do you think are the 2 biggest barriers preventing use of mental health and psychosocial services? If we create these avenues for mitigation, if we create psychosocial support at the community level and engage all professionals, what do you think are some of the things we need to be aware of that will be barriers to uptake, that will prevent people from using these services? Is it stigma of mental health? Is it religious beliefs? Is it the cost? Is it attitudes to help seeking? Is it availability of mental health and psychosocial support providers? We know that all of those could be a part of it, but from your perspective, where you operate, which 2 do you think are the most significant barriers to uptake that would prevent citizens, members of the public, from actually making use of these services? So over to you. So we have the ever challenging stigma of mental health issues that prevent folks from actually using what is available. While there may be issues around availability of providers, etc., the stigma remains major. And I think part of what we have to do is rename it to tame it. Let me change that phrase. We need to rename it. We need to stop talking about mental health as a psychiatric issue, as a disorder, as an illness, as crazy. You know, even when we talk, the language we use as health professionals, when we say psychosocial, I wonder how often we realize that the word psycho has a whole different meaning when people hear it. It doesn't sound like healthy, it doesn't sound like normal, it sounds like crazy. So we have to come up with new strategies of dealing with the stigma of mental health. We have to come up with a better understanding of the cultural barriers, some of which may be based on faith beliefs, whether accurate or inaccurate in terms of the faith, because people misinterpret their faith teachings sometimes. But whatever it is, climate change, just as COVID has, is going to require an understanding of the barriers, and understanding that maybe in the same way that COVID has made more people aware of stress as something that they need to cope with, we need to leverage those learnings and expand them to be able to address some of the challenges that climate change is going to continue to bring, along with the disastrous events. All right, so we're going to move. So I use the term before mental health and psychosocial support. It's protection or promotion of psychosocial well-being and preventing or treating mental conditions. So what we're about is saying, and the Caribbean Alliance of National Psychological Associations is working very hard in the region to partner with various organizations to facilitate the research that is needed to understand the dynamics, but also to build capacity in the delivery of appropriate services. And that is going to have to include capacity in developing the messaging around psychosocial needs and their intersectionalities with all the different social ills that we're dealing with. So whether it's everything from the COVID pandemics, the climate change, the economic upheaval, etc. All of these have got to be framed in the right way if we're going to achieve success. There are many different levels of helping. And so when we engage with the public, with clients, we have to understand that the needs vary and our systems and resources need to be allocated appropriately. At the base of this, you're always going to have people who just need the basic information and resources. Then you need those who need more psychological first aid, then those who need more targeted counseling, and those who need mental health interventions that require some kind of professional skill. Perhaps it might include medication. And so we have to have as our core principles that all deserve care. Human rights and equity have to be at the base of this. As we develop services for mental health, whether it is around climate change or whatever context, we have to ensure that there's participation of all who are being affected. So we need to hear what is happening on the ground. It cannot be a top-down thing. But in every case, we must do no harm. We must build on available resources, including cultural beliefs, etc. We must integrate systems, so it needs to be coordinated and collaborative, and it must have a multi-layer approach. As I just mentioned, there are different needs at different stages, whether it's acute or direct, or whether it's overarching or intersectional dynamics. We have to be targeted. I'm going to jump to this and point out to the pyramid model, which is promoted by the IASC, Interagency Network, promoting mental health and psychosocial services, and saying that we need to be able to address the basic needs of folks. And at this point, I'm just highlighting the fact that we need to influence mindsets, how people look at self-care when it comes to mental health and when it comes to relationships. At the core, we need to build those competencies because individuals need it and the community and family need it. But different interventions are needed at different levels. So you need the emergency response for the people who are being affected, the smaller number whose well-being is being affected. And then you're going to need more intense support for the even smaller number who require a different type of intervention. And at the top, those suffering from psychological disorders, either pre-existing or as a result of the process, the extreme event or the chronic process, they need a different set of services also. So we need to be prepared. And I'm just sharing this graphic because it highlights the model of psychological first aid. It is saying that all of us, whether in our personal or professional life, need to prepare for these crisis events. We need to understand what's available and understand what the safety and security concerns are. And this is particularly true if you're a healthcare worker who is a first responder or who is being engaged to facilitate a process of psychological first aid. We need to be able to understand, we need to look at what is happening. What are the safety issues? What are the urgent basic issues? Who is in distress? Our helping relationship also has to be informed by our listening, making contact, establishing rapport, understanding the needs, assessing safety, and helping people to calm down. And this is true whether you're talking about a disaster, at an event, at a point in time, or as a social change mechanism. This is something that we have to do. Whatever kind of program we're creating, we have to prepare for it, we have to do the research, we have to observe and get data, we have to listen and understand what people are experiencing, and then we have to link them with the appropriate resources. Again, this has a particular significance when we're talking about mental health because of the stigma, and of course, to a lesser extent, or another extent because of the resources that may or may not be available. But a link to a resource is not saying to somebody, oh, call this number and they'll help you. It's about helping them to understand the service to be expected, helping them to make that connection so that they can actually access what is available. So we're going to have more regional cooperation. And this slide was shared earlier about the attempts that the region is making with the support of PAHO and other entities to create a consortium that looks at all of these issues. But you will notice that there is no mention, no prioritization of the psychology of disaster and climate change, no mention of mental health. And I think that one of the things that CANPA is determined to do is to put mental health as central to this work, not to central, not to make it more important, but central to make it a focus and to increase appreciation of the impact that understanding the mind, understanding human behavior, understanding mental health has on all of these other areas. Yes, it is implicit in health, but it should not get lost that it has an impact in terms of water and agriculture and tourism, etc. So working towards having comprehensive and action-oriented health national plans is one of the things that's being focused on. Early warning systems and identifications of determinants, having a One Health approach to the climate change challenge, promoting awareness, and of course, tools to estimate the co-benefits of climate mitigation, because we always need that data. I think the point I just wanted to make here is that there's a lot that needs to be done, but we need to all be clear that our paradigms or ways of looking at things are not giving us blind spots. You know, in the region already, we have a lot of programs. UNICEF, partnering with various agencies across the region, developed the Return to Happiness program to help children deal with disasters and post-disaster experiences. I'm just sampling some of the ones that are available. PAHO has done a series of videos and has an online training course that teaches about psychosocial support, mental health and psychosocial support, teaches about psychological first aid. UN Women, along with PAHO and other entities, are working on a self-care toolkit to help people understand the different dimensions of wellness and how they can manage their self-care in all those areas. SIDEMA, UE, CANPA have been working on creating a network of psychosocial providers in the region who can be involved in deployment to disaster sites when people are called out, but also can ensure that any interventions that are initiated during a disaster are integrated into ongoing support systems in the countries. So we're trying to build those capacities, and that is a focus for CANPA. And I should mention also that I'm aware of a number of corporate entities, regional corporate entities, who are trying to create their ESG programs, you know, their environmental, social responsibility and governance programs to include wellness programs for staff. Again, because we need to create those core mental health skills if we are going to be able to facilitate resilience in times of challenge and disaster. We have to mitigate from the start. So it is a reminder, not everything that counts can be counted, but we still need data. There are nuances that perhaps are going to be identified by qualitative research that may not come out in quantitative research, but it doesn't matter. Research is required if we're going to have those effective interventions that are going to deal with the chronicity of the challenge of climate change and its effects on mental health and well-being and people's behavior. And I'll end with this crisis. And you know, it says when written in Chinese, but of course, that alone does not acknowledge the diversity of Chinese languages. However, the concept is crisis is composed of two characters. One represents danger and the other represents opportunity. When I first saw this, I long ago, I just took it at face value. And then recently I researched and found that apparently crisis really is a combination of characters that talk about danger and choice. It's a matter of choice. And I think that therefore we need to be reminded that as much as there's a crisis in terms of climate change, and so many other areas. Those dangers also provide us with a time to make choices. And I would hope that those who have participated in this forum over the series, or perhaps only in this forum, will leave with the sense that there are choices that we can make, choices that are driven by active hope, choices that have to do with how we take care of ourselves, how we contribute to the well-being of the people around us, and how we also help to mitigate against the negative effects of climate change, because we are all together in this. It's one world, and we have hope, but it's going to take action. So I'll end there. I will stop the screen share and turn back over to our facilitators. Thank you for your attention.
Thank you, Dr. Waller. That was a fantastic and informative presentation. That was very well received. So we're going to start the question and answer portion of tonight's session. And as you said, it's a discussion, so feel free for the other panelists to join in. So the first question is from Dasiv Bryce. I hope I pronounced that correctly. Are the mental health effects that are related to climate change, are they permanent or reversible?
It's an interesting question. Thanks for that one. And again, it reflects the diversity of people. There are some people where the impact may not be easily reversible, but it can be ameliorated, and others who it's just time limited. It's a response to a situation, and it will be resolved. I think a lot of it has to do with how we look at it, because it can be a self-fulfilling prophecy. Because remember, life is stressful in general. If you don't have stress in your life, you're dead. People don't like to hear that, but it's true. The only people who don't have stress are those who are no longer with us, because by definition, life is stressful. Now, there's good stress and there's bad stress, and there's healthy and unhealthy coping. But I think the point needs to be made that it's our understanding of it and how we look at it that makes a big difference in not only how we cope, but how it impacts us. So I will answer in that way. Thank
you. So as a follow-up to that question, Dasiv also wants to know, in your experience, how long can management take? Is there a specific time, or is it, as you said, just case by case dependent? Yes, there's really no way to predict how long there will be an effect, because it depends on the individual and it depends on the situation. It also depends, of course, on the coping skills that the individual has and the support they have. But it is a reminder that we cannot pathologize this and make it into an, we have to normalize that. Listen, you're going to feel bad. This is scary, but it doesn't mean you're out of control. It doesn't mean it's hopeless and it's unending. There are things we can do. Great, thank you. So we have a question from Karonique Decius. You mentioned, when we talked about vulnerable groups, you did mention the first responders, the climate activists, and that they were also at risk. So they want to know, how does that secondhand trauma, how can we address that? What supports can be provided for those individuals and those groups of people? So there are a number of different levels. First of all, we need to understand it. And we keep getting back to the research, and that is why it is so exciting that Earth Medic and Earth Nurse are looking to collaborate with CAMPOD to do the research. What does this mean for different people and different groups of people? And if we understand what it means, then we can design the intervention, whether it's the messaging, etc. Because I keep using the phrase, and it's a cliche, but it really, if you name it, you can tame it. If you don't understand something, you can't intervene. And I think, therefore, it's going to be important for us to understand the vicarious stress that all of us feel because of this process, but particularly those who are at the forefront as activists, etc. Because it depends on why they're doing it. People have different motivations, and that will then influence how they can be helped. But we certainly need to provide that support. Over. Yes, thank you. So the next question is a little bit related to research and data. This is from Vinud Sibarat Missa. And he wants to know if there's data in the Caribbean about any rates of suicide after disasters, which we can link to that stressful event. So do we have any evidence?
We have anecdotal evidence, most recently out of the Bahamas. I don't think there's been any robust research done, but again, this is the kind of research that is needed. We do have anecdotal evidence of that, and we do have anecdotal evidence of increased suicidal ideation. But again, we have to be very careful. Suicidal ideation may be an indication of a feeling of helplessness and why bother, but does not indicate intent. And I think that one of the things that social media has done, and media in general, it has raised the concept of ending it all as a viable idea. It's an idea, so you think it. People would never have articulated it before. Now they will articulate it. It does not necessarily mean they will do it. So again, it means that we need to understand suicidal ideation and the whole concept of suicide in our cultural context. And again, it's not one Caribbean culture, it's many cultures. So,
yeah.
But it does seem to be increasing in terms of the ideation, yes.
Yes, I posted a link in the chat, which is maybe in reference to what you're talking about the experience in the Bahamas after Hurricane Dorian. Some of them wrote an article just talking about their own personal experiences.
Yes.
So we have another question from Joseph Antwine. He wants to know, what role can a community development approach contribute to mental health resilience?
It's a critical role, because it's going to have to be, it's at the community level that we get that collective change in paradigm, that we move away from help seeking and mental health as stigmatized, and we understand we do it already. We already cope with anxiety and we already help each other. So giving it a label is sometimes unhealthy because it takes it out of the norm. But I think that the community interventions are going to be critical, both in terms of normalizing the responses to the climate change, but also promoting the coping strategies, and building a sense of community around it, because we're going to have to help each other, and we're going to have to therefore make referrals viable and make people feel like it is okay to ask for help. So yes, the community and collective is critical. And it means therefore, sorry, that we have to train up and build capacity for those who are working as community activists and organizations. So they're further up the learning curve, taking care of themselves and really being able to then advocate that to other people.
So just building on the last point that you made, then should all healthcare workers or people working in any sort of health setting, should they be trained in basic psychological first aid?
Oh, I definitely think so. And I again, sometimes we give names to things and then it becomes something different and unique. The point is, there are core competencies in understanding, preparing and understanding what's going on, then collecting data by looking, listening by connecting with people so you can reach them, and then helping them get the services they need. And why, one of the reasons that this is so important is that it helps to prevent burnout, because you see, many people who are in the helping profession and caregivers don't have articulated boundaries of what they can and cannot do. And then they lead to unrealistic expectations, which then ends up being a burden on them. Then they get lost to the system and their excellent resources are no longer available. So it's a preventative tool as well as protective.
Right. So we have a question from Karen Lewis Bell. This is an interesting one. How do you engage people whose belief system does not support that they can do something to mitigate the effects of climate change and the impact on their mental health?
That's a good one, Karen, and a hard one. I think, again, it gets back to understanding the belief systems. In my experience, there's always an aspect or element of somebody's belief system that allows some leveraging in the direction in which you want to move them. So that even if somebody has a strongly based religious belief about X, that same religious belief has something to say about Y that allows you to take Y into the realm of X. They already have some belief, whether it is caring for the weak or whatever, that allows you to connect with them, and then you can leverage it. But of course, again, it's gonna require the research, but it also is going to vary at the individual basis. from individual to individual.
So you've mentioned a lot in your talk and in your responses now. Keep hearing the word research. Research is coming up.
Mm-hmm.
Can you just sort of summarize for us some of the key research areas that you think we should focus on?
Yes. Existing belief systems. I mean, we've touched on that there, whether it's cultural, faith-based, or whatever. What are the existing belief systems that are influencing people's willingness to change their attitudes towards climate change generally, and then specifically about mental health and self-care? We need to understand those belief systems. It's, we learn from the days of HIV and AIDS. We need to do the knowledge, attitudes, and practices research to get that sense of the context. And then at the other end, we need to therefore do the research to identify the skills that are needed, the tools that are needed. And I say research because we need to match the skills and tools to the needs, but we don't need to reinvent the wheel. And I think there are many tools already available for dealing with trauma, with different target groups and etc. that exist. We need to be able to research them and then choose what are best for our Caribbean region. It doesn't have to start from scratch. And I think that's a step that's very often left. Unfortunately, there are those who come into the region and bring what they've used elsewhere. And because we're anxious to make a difference, we use what they've brought and we don't do the corollary research to see, well, is it really working? How could it be tweaked? What could we change? How could we integrate something done somewhere else? So again, I think we need that level of research. And then of course, you always have to monitor and evaluate. So, you're designing interventions that are theory and evidence-based, so you need that, but then you have to monitor whether the intervention is effective. And that requires a whole nother set of competencies and resource allocation. And I guess an area of research, although it might not sound like it, is where can the resources be found? There are many organizations who are willing to fund things, whether they are NGOs or corporate or state, but this kind of work is going to take resources, and we need to identify that. And finally, we need to create a coordinated and collaborative strategic response, which means that we need to know who the players are, who are the influentials, and we need to get us all together, as has been happening with your fora, and come up with a joint strategy. And that also requires a certain kind of research. Somebody just mentioned indigenization of interventions, and I think that is part of what the research needs to be. What do people do already? What works? What can we build on? That validates people's lived experience. This is not to just bring in something new top down. I am whoever and I'm telling you what you need to do. Sometimes people know what they need to do already and they've been doing it. They just don't know enough about how to scale it up. And that's where we can help.
Absolutely. Just a short pause. Dr. Henry, did you have your hand up? Did you want to, is it a CME reminder? She's probably stepped away. I think we should be placing the link for the CME in the chat box. So please look out for that and remember it remains for 2 hours.
Yeah, I'm trying to unmute. I have a question that's really bothering me, right? So when comparing the economic impact on SIDS, the Caribbean seems to be disproportionately affected, right? We know that economic loss is well correlated with mental health impacts. And I just wanted you to tell us a little bit more about how you're thinking about this.
Well, okay, so the small island developing states, are the Caribbean and of course the Pacific Islands, etc. And there are lots of commonalities, not just the impact of the sea and etc., but also the small spaces in which we operate. I'm going to give you a slightly different answer to this. I think we have a particular challenge in small island developing states, which is a function of our smallness. It's a really strange dynamic where, because we're small, we should know each other. And because we're small, we don't know each other. We operate in silos. We operate in in a us and them, and the us and them could be just a geographic us and them, it could be a political us and them, etc. And therefore, I think if we're going to address some of these challenges, including the economic, Dr. Henry, I think that we have got to start sharing information and getting to know each other so that we can collaborate and coordinate. When I first started doing this work, there would be a lot of work done by international agencies, USAID, etc., and they would come to our small spaces and do trainings that were supposed to be capacity building. But they didn't realize that who they were talking to was not necessarily the people who needed to be talked to, and they couldn't, and they made assumptions. They made the assumption that if you throw a pebble in a small pond, the ripples will reach everywhere. Well, we know that you throw a pebble in a small Caribbean pond and it bounces back all over the place because this one doesn't talk to that one, and that one is competing with this one for funding, etc., etc. So I really think that there are many answers to your question, but the one I would want to highlight as a psychologist is understanding the dynamics of the relationships and preempting some of the problems that we know exist by designing interventions that will overcome those barriers. So I know it's only a small answer because it's a big question.
No. So you're making a very strong point about collaboration between the different territories, something that we have struggled with probably since 1962, right? Those of us who are a little bit older will know about that.
Yes.
So I think we need to take a new look at things now, and now is the time where we need to begin collaborative efforts between the different territories, because if we don't do it now, we would always remain very small island states trying to battle against big changes like sea level rise and climate change and surging tides, and we're going to be lost because we can't do it alone. We can only do it as a region, and we will have much more power if we can come together as a region and see this as an existential threat that we need to look at together. I would need one more quick minute to talk about CMEs, though. Tell me when it's a good time, Dr. Lauren.
You can do it now, and then I'll go to Dr. Hospital.
So let me just go very briefly. There's some people who have been trying to pay for CMEs but didn't get through because their bank did not allow the transaction. So I will send that list out, those people who have not been able to pay because their bank didn't allow payment. But basically what you need to do is call your bank and say, listen, I'm trying to pay for this CME by a chef. Please unblock the whole to allow the transaction to go through. Okay, because you can't get your CMEs if you don't pay for them. Thanks.
Could I just jump in and pick up on just one of the things that Dr. Henry said? We have got to, and I think Loxley or somebody commented on why we don't coordinate and collaborate more. I think that is external influences, but there's a history, as Dr. Henry said, all our post-colonial history. However, I would have to add that if we can't collaborate internally in our countries, we will not establish any collaboration across the region. And I think that to me, that is a critical part of it. We have to talk to each other in our small spaces, and then our regional space is far more likely to benefit from that.
So on that note, on the conversation about surrounding research and collaboration, I'm just going to ask Dr. Hospitalis to talk a little bit, because he mentioned in the chat that Earth Medic, Earth Nurse is working on their research for action agenda, and mental health is going to be part of this. And I wonder if you could just share with the audience a little bit about that.
Well, thanks, Lauren. So good evening, everyone. Yeah, there is a collaboration on research for climate change and health in the Caribbean between Earth Medic, Emory University, WHO, UWI, and Yale University. That ran the conference last year. Some of you may have attended, and we're working on finalizing a research agenda for climate change and health in the Caribbean. It was initially guided a lot by the Lancet priority pillars, and then more recently we've had a lot of thought and dialogue, including with the Caribbean Association, Alliance of National Psychology Associations. And we've taken a clear decision that mental health needs to be a priority in this list, given the incredible economic burden. And if you lose your house and you lose your job and you lose your everything, you can't help but experience stress, depression, anxiety. It seems to be, and possibly even in suicide. So these need to be better studied. The other priority here is population displacement and migration. They go hand in hand. If you're displaced and you have to move, you're gonna be mentally affected. So I do want to share that. So look forward to that agenda being shaped up in the coming months.
Great, thank you for that. And yes, we'll certainly be looking out for more information on that. I think, so yeah, I think we can wrap up now. Thank you very much, Dr. Waller, for this fantastic discussion. It's rightly said at the beginning on mental health and bringing it to the forefront. We have a lot of work to be done, but I think we have the right people, and hopefully we will get the resources in place to start making a difference and start doing the research and getting information out there. So thanks everyone for attending this evening's session. Please don't forget the CME link. Any questions or concerns regarding CME, you can contact Dr. Henry. Don't forget to join us next week when we're looking at another clinical case on flooding and mental health. And we will hopefully see you all again next week. So good night, everyone.
Right.
Thanks for having me. Wishing you all the best.
Thanks, Peter. Great job.